So once again, a very good evening to everyone who's watching us live. And we are here this time on a Tuesday because of the auspicious occasion of Diwali on Thursday. So we have decided to advance this webinar. So we are continuing with the webinar series on community pulmonology. And this is the second part. In case you missed the first part, it's available on our YouTube channel. Today, we'll be talking about you've done your research and you want to take it forward and publish it. So we are talking about evidence generation for pulmonologists part 2 today, and we have a very elite panelist group here today. So let me begin with the introductions. Dr. BV Murali Mohan from Bangalore. He is a senior consultant pulmonologist, and he is also the academic director of Department of Internal Medicine from Narendra, Bangalore. So welcome to you, sir. And then we have Dr. Aditya Chawla. He is a consultant respiratory medicine at Saroj Super Speciality Hospital and Jaipur Golden Hospital at New Delhi. So welcome, Dr. Chawla. We also have Dr. Kumar Utsav. He is a consultant pulmonologist at Varanasi Chest Clinic at Varanasi. And welcome to you too, Dr. Utsav. We also have Dr. Praveen Kulkarni. He is an associate professor of community medicine and public health at the School of Public Health and the JSS Medical College at Mysuru. So welcome, Dr. Praveen, and we look forward to having a very good discussion. But before we go on, first we would like to hear from Dr. Praveen, who will be taking us through a short presentation and giving us the, I would say, nuts and bolts or nitty-gritty of the publication process and data presentation in a nutshell. So over to Dr. Praveen for your presentation, and then we will have the question answers. We also request the audience to keep putting up their questions in the chat box. We'll take them up as and when we proceed. Over to
Good evening, everyone. At the outset, I would like to thank CCI for giving me an opportunity to interact with you all. And today we are going to discuss one of the very important topic, which is quite essential for all the academicians and the researchers to know, understand, and practice is the art of writing a scientific manuscript. So when we talk about manuscript, when we talk about publication, several questions arise. Why do we need to really publish? The reasons which are quoted are, it is going to help us in getting research excellence, so we can become excellent in a particular field and we can advance professionally. So for the promotions, or it could be for getting professional recognition, we need to have the publications. Third and most important is to qualify for grants. Whenever we write the grant applications, a common question that the sponsoring agencies will ask us is, do we have sufficient number of publications in that particular area? And if we have the publication, then we will be qualifying for the grants. And it is a matter of prestige to have publications in high impact journals to contribute to our institution. It could be any kind of ranking, or it could be the recognition from UGC, or it could be recognition from any professional bodies. The publications are definitely going to help us. And more importantly, with the publication, we can contribute enormously to our field in which we are all working. And the publication will add a lot of personal and professional satisfaction, and also it will help in professional development as well as enrichment. And a common question researchers often ask, when do we need to start thinking about publication? Please keep in your mind, we have to start thinking about publication at the beginning of the research itself. That's why it is always told, keep the end in mind when you are beginning. And no work is complete, no research is complete unless it is published in good quality research journals, which is widely acceptable in the scientific community. The answer to the question when to start is to start the thinking about publication, conceptualization of publication at the start of your research itself. So whenever we talk about the publication, We often think only original research articles are the publications, but we have ample, as I have listed in this particular slide. It starts from a simple letter to editor and invited editorials, review articles. Review articles often get lot of citations. Original article, which is required for our promotions and academic advancements, short communication, simple case reports, and viewpoints or perspectives, abstracts, commentaries are few types of manuscripts. Let us now discuss, with the wider interest of the audience, we will be talking about the original research article, the way of writing the original research paper. A commonly accepted format for original research articles is what we called as IMRAD format. So this is what we call as anatomy of a research manuscript. It has got various components. Number one, introduction, which is going to tell us why did you do this particular study and why are you publishing it. And it also includes some amount of literature review. The next component is how did you do your research, which is all going to get involved, which get incorporated in the section of materials and methods. And after you did something, what you found out, that is what is called as results. Results is a set of observations, set of outcomes out of the research. And finally, after you found out what is its significance, how it is different or similar to others, and what is the future of this particular finding. So that's we call as discussion. And finally, for a person who is reading the paper, you are going to give a concluding remark. What is the final outcome of your research manuscript? So this is what we call as anatomy of a research manuscript. Now let us see part by part. So one after the other. The first component is introduction. In introduction, we are going to write why we are doing this particular study, what is already known and what is not known. This is exactly what we deal in the literature search, and what we come out of the information search, what we call as review of literature. That should also be a part of your introduction. And always at the end of introduction, include what was the objective of the study, what was the hypothesis with which this particular study was started. Some people keep introduction very short. At least 500 words introduction is essential to make it more, more appealing to the audience. And the second, what we call as a heart of manuscript, is material and methods. This is going to tell us how did we approach our study. This is highly important scientifically because authenticity of any research depends on the material and methods. And we always should start this material and method with the study design and ethics statement, which indicates whether the study has received approval from institutional ethics committee and whether the consent was obtained. Mention correct study design and where was the study conducted, and what was the duration of study, and the period of study, from which year to which year or which month to which month the study was conducted. Explicitly mention how was the sample size calculated, and after calculating the sample size, how did you select your study subjects. And more importantly, mention what are the inclusion and exclusion criteria. And very important thing is, when you're talking about any scientific research, keep in mind you need to completely describe the biochemical, pharmacological procedures, instruments, their standardization, their calibration, complete methodology, technique of the particular procedure. And if you are doing a study using a questionnaire based tool, always describe the method of validation of the tool, and when the tool was implemented in the community for collection of the data, how was the quality of data collection ensured. Usually we prefer to keep a flow chart for methodology, if the study includes more than one phases and if the study is a stepwise conduct of the study. So this is a simple flow chart which is going to tell a person who is reviewing or reading the whole methodology of a study at a glance. And after you completely write your methodology, please describe the method of statistical analysis. How did you do it? How did you enter your data? What was the software used for data analysis? Keep in mind, whenever you are saying this particular software was used, check whether it is actually licensed to your institution. Next, what type of descriptive statistical measures like mean, percentage, standard deviation, what kind of descriptive statistical measures were used? And which tests of significance were applied? For example, you might have heard about something called t-test, paired t-test, unpaired t-test, something called chi-square test, and there's something called ANOVA. What type of inferential statistical tests were applied? And also mention if you have applied advanced statistical tests, for example, regression, correlation, please mention which one has been applied. And please don't forget, whatever tests you have applied, only mention those tests. And the results of all those tests should be available in the result section. Keep in mind, do not mention anything which is not applied and mention everything you have applied. And what was the level of significance you have fixed? I'm going to talk about this level of significance a bit later. When you're doing the data entry, please keep in your mind, so you are going to do the data entry in Excel. That is a best useful software and which is quite available, worldwide, and it is quite easy to enter the data. Always keep the first row for the variables and do not merge multiple rows, and try to enter the data in coded form as much as possible. And whichever code you have entered, please maintain a sheet for codes, and there all the components of the decoding should be available. And after you enter the data, you will be doing statistical analysis. And when you are writing the results, please keep in your mind, if you have 4 objectives in your paper, the results for all 4 objectives should be visible. You can either put as a subheading for each of them, or you can continuously write it. But keep in mind, all objectives should be satisfied. And initially, when you start writing the results, don't jump in writing the results for the objectives. First, start the general characteristics of your study subjects. What was their age distribution, gender distribution, their education status, occupation, and then proceed further for one by one objective. If you could see in this particular paragraph, one of our study was to assess the nutritional status of children. That was one of our objective. We described it under one particular paragraph. Always keep in mind, everything in the table need not be described in the paragraph. You can describe the key components of that particular table, and if the reader wants to know more about it, direct him to the table from which this excerpt has been taken. Keep in mind, this is going to reduce the burden or the length of your entire result section. And when you're writing the table, please keep in your mind, the table has so many components. Just do not put a table with the numbers and some percentages and call it as a table. Table should have all these components which I have mentioned. It should have a table number. It should have a particular title. It should have what we call as a stub, which is the categories, and it should have the body, what we call as the entire inner component of the table, and it should have, if required, a footnote to describe what is there in the parenthesis or what type of test you have applied to come to a particular diagnosis or particular interpretation. And use graphs judiciously when you are writing the paper. When the data can be easily represented using the table, there is no need to go for a graph. There are some authors who will put for the same variable graph and the table, which is actually not required. You can use simple graphs like simple bar diagrams when you have one particular variable to describe, And if you want to show before after between two groups, for example, knowledge between two villages, you can use something called as multiple bar diagrams. You can use a pie chart, which is very commonly used to say the categories. And if you have the continuous data, try to explain it using the line diagram, which I'm showing it here. And if you have applied correlation, that is, want to show the relationship between two continuous or quantitative parameters, you can use something called as scatter plot, which clearly shows with increase in one particular variable whether the other variable is changing or not. Please use the graph judiciously. Do not put too many graphs, or if required only you can use the graphs. And when you put a table with statistical analysis, please do not forget to describe what is your outcome, what is your interpretation of statistical analysis as one paragraph at the bottom of the table, and definitely directing the viewers or the readers to that particular table. Here, if you see this table, it looks very complicated. But what we did was a simple outcome. What is in it for the reader to take out? Where we are finding the statistical significance and where it is a clinically significant finding, that can be written as a narrative at the bottom of the table, so that the readers can not, readers can easily interpret the research findings. And one more important thing is p-value. So we are all so obsessed with the p-value. So please keep in your mind the statistical significance is more important than the clinical significance. If p-value is less than 0.05, it means that 5 out of 100 observations are because of chance, and 95 observations out of 100 observations are true, not because of chance. So you are evaluating the chance factor. Usually we allow 1 in 20 observations or findings to go by chance, and 95 observations to go by to be a real observations, or we call it as the true difference or true association. And in discussion, discuss all important key results or key findings. Okay, and discuss why your findings are similar or different from rest of the studies, and be very logical in sequencing this discussion section. It is a time consuming, we all know, but it should be done in a very systematic manner. And if required, you can provide the comparative tables. And at the end, write the conclusion up to 100 words. Be very brief in it. Mention only key findings of your study. Do not repeat everything that you have mentioned in the result section. Please remember, conclusion is not a summary. Abstract should be written. We usually recommend to write at the end. So it is a trailer of a movie. Make it more interesting. So mention all important key messages, key results of your study. And the word limit depends on the journal. Some journals require 250 words, some require 150 words. Keep in mind what is the requirement. It can be structured where there are separate subheadings, and sometimes it need not be structured. And you can mention the mesh words from the PubMed. Take out those mesh words which are in line with your abstract, and you mention them. And cite all the references in the text, and references should be cited in sequential manner. And there are many styles which are available, and Vancouver is the commonly used method. And more than 50% of the references you can keep as a recent ones. And the ones I have shown at the bottom, so do not do like this. So for one particular sentence, people will write 1, 2, 3, 4, 5, 6, 7, 8. And sometimes they write 1 to 10. If you look at their list of references, they will be 100, 200, something like that. Okay. And after that, after your manuscript is ready, give it to few people to read. Your author panel, let them give give them their remarks, and based on that, modify it. And always select the best journals, at the beginning, with a high impact factor, that is in PubMed, Scopus, or others. And if they get rejected, then go for the national journals of academic importance. And then always submit article to one particular journal. Do not submit it to multiple journals and get in stuck. Okay, so after you submit your paper, it will go for editorial review. They will check whether this paper fits for their journal or not. And if it doesn't fit, they suddenly directly come to the decision that it is not suitable, or if they find it is really good, they may take a positive decision also. If it is found okay, then they will send it for the external review, and external reviewers will give their comments, and they may directly also take decision by looking at the paper. It may be good or poor, or they may accept it or reject it, or they may give you some sort of comments, and after that you will revise your paper. Then you will be sending it again back to the external review, and then it will undergo 1, 2, 3 times reviews, or sometime it may go for 6, 7 times reviews, and then they come finally to a conclusion, and that decision could be either accepted or rejected. If it is accepted, then it will go for language check, author proof, and then finally gets published. And if it is rejected, the same cycle continues. You need to find out a new journal. And after you receive a reply from the reviewers, read the comments carefully, discuss the comments with your author panel, and if required, take advice from the experts, especially related to statistics. Provide point-wise clarification to their doubts. And if you feel that these comments are not really feasible to be answered, please, you can politely mention the same, that this is not feasible at this point of time in the study, and be clear with your justification, show it to multiple people, and then come to a final conclusion. And this is all in the box for you, for me. So we discussed what is the importance of publication and how we exactly need to publish the paper, and then we mentioned what are different steps in it and what happens after the paper goes for publication. So I wish all of you a very happy scientific life of publication. Thank you very much.
So thank you, Dr. Praveen, for taking us through that whole cycle and in such a nutshell, but still very precise, very focused, and you've given us so much of tips. I think that would definitely help people who want to publish. So let's start with our panel discussion. And once again, I welcome all the panelists. Dr. Murali Mohan from Bangalore, Dr. Aditya is there with us, and then Dr. Kumar Utsav, as well as Dr. Praveen, who's just given us some tips as well as covered the whole thing in a very beautiful way in a nutshell. So I'm getting questions from the audience. We will start with some of them. Let me first of all go to our panelists and start with some of the questions that I also have in mind. Probably these will also help. So I would like to place my first question to Dr. Murali. Sir, we've just seen how Dr. Praveen has taken us through the whole process of writing. But I'm sure many of our audience are still beginning, and they must be thinking that, yes, I want to write, I have the research, but how do I start? Where do I start? Where do I begin, and then how do I go about? So could you please give us some tips, enlighten our audience about this particular aspect? I'm sure this crosses many of our minds when we started off. So Dr.
I think the most important thing is be bold and start. Okay, for every writer, the first most difficult step is to start writing. Okay, so when you start writing, it's not the way you did your study. When you did your study, you started thinking about what is the research question. So all those were already. So when you're starting the writing, the one you already have, the one that's very clear is your methods. So I would start with the methods. So as you write down your methods, and remember the methods, as Dr. Praveen said, are extremely important. Any scientific paper has validity only if it can be reproduced, and it can be reproduced anywhere. So you have to state your methods very clearly. So that is the first thing I'd start with. That's the thing which is unchangeable. You cannot change your methods after you've done your study. So please make sure your methods are written first. The next thing after your methods is you've got your results. So you write down your results. And once you've got your results, then you start writing your discussion and conclusion. Now you have all that. Dr. Praveen has taken you beautifully through those steps. Now you write your introduction, because that was the back of your mind all along, but you don't write it till you've written your discussion and conclusion, because very often what you have come to a conclusion, the results may point you in a slightly different direction. So you write your introduction then you try and concise it, make an abstract. And honestly, sometimes the most difficult is to find a suitable title. So you write the title last of all. So it's usually methods first, then results. Based on the results, your discussion and conclusion. And then you write your introduction, then the abstract of what you did, because it's a nice summary and will bring out aspects of your study that you know you must focus on. Because honestly, what is often read is only your abstract and the title. That is all. People read your title, then they'll read your abstract, and then they'll choose, should I read the rest of it or not? There is so much research published that nobody can read every paper in detail. So please make sure your abstract is written well and encompasses, encapsulates everything in your study. So that's how I would suggest people write. But I think the most important advice I can give you is start writing. Okay, overcome that block and start writing.
Thank you so much, sir. I think you've given us a very good start, and you said that, first thing is to start writing, being bold, taking that step and overcoming that inertia that I do not write. So that's very important. And of course, methods. And you rightly brought up, sir, that abstract and title. In fact, would any of our panelists would like to chip in with any of these other things, or maybe title? Praveen, any tip on that, if you have quickly to add before we move on?
Okay, yeah, thank you very much, sir. I would like to thank Murali sir for bringing very important components. So one thing about the title, we have a habit of keeping title very fancy, and to make it more attractive, to make it more readable, so that people will look at the abstract title and then start reading the paper. That's fine, but one thing we need to keep in mind, it should be scientifically sound also. And whatever we have done, the same thing should be reflected in the title. And to just make it more fancy, or to make it more attractive, we should not make so much of changes in the title, so that it loses the essence. And the word limit for the titles is also now being now people prefer to have the number around 25 words in the as a word limit for the title, except the clinical trials, where the clinical trials will essentially require large title, because the components will be more. And and sometimes title also depends on the journal requirement. Some journals want the place of the study and the type of the study in the title, and some journals do not. But one thing we need to keep in our mind, the title should be purely based on the objective of the study. Okay, so not based on the result of the study. Please keep in our mind, please keep in your mind, the title will be decided at the beginning of the research, when the results are not out. Okay, keep that thing in mind, and then decide the title, unless required otherwise. I think this is all from my end, sir. Thank you.
Yes, thank you, Praveen, because Praveen also, Dr. Praveen happens to be the associate editor. Correct me if I'm wrong, associate editor, right, Praveen? Of IJHAS, International Journal of Health and Allied Sciences. So that's really nice. Thank you. And yes, as you rightly said, that it's important for us to keep it concise, but I do like to add that basically you can sometimes, if there is a very important finding, based on that, Praveen, I'm sure you will agree, as Dr. Murali also said, you can actually modify the title to give that as an importance, right? So you could, but yes, obviously your objectives will decide. So very good. Let's keep going. And with that, I think I would also come with very similar kind of related aspect. Dr. Aditya, I would like to know your thoughts about, see, they both highlighted about the title, the abstract, that's the most read. Now, how do I highlight the uniqueness of my study or my research in the paper that I submit?
Thank you, sir. Sir, according to me, the paper must have a message, first of all.
Right.
A good message can be put in one sentence. Some journals now require this one sentence beneath the title of the paper also, in order to put it in the table of contents in the index section. So a second issue is that, so what? So do the findings have any implications? Whether a journal accepts a paper often hinges on whether its messages are new, it expands, or confirms or rejects the published message, the previously published message. So now we are currently living in an era where medical information is excessively available on the net. So before publishing an article, we should always think that is this enough clinical relevant information that is gained from our particular research paper, and does it add any new information to what we are already knowing? Because the reader, when the reader analyzes, or when it is going for review, everybody thinks that the main question, that is this information also real, कि actually किया भी होगा कि नहीं किया, then is it going to be useful for the day to day patient care? Then third is like every scientifically proven hypothesis has a counter agreement that is available on the net also, with publications, with scientific evidence available. So we have to think that which information is accurate, and this is the dilemma that is being faced almost by every practicing physician in every specialization.
Thank you,
So
Dr.
we are highlighting, and we should point it out that suppose we are writing a case report. So case report has the uniqueness that the case has not previously been described, or the syndrome or disease has not been described, or there is an unexpected association of two or more diseases or disorders which is previously unsuspected. And then sometimes it can be the reporting case is reporting a new variation or a new symptom that has not been previously known. So these kind of things are the one which set aside your paper with the uniqueness.
Right. Thank you. Yes. And very rightly brought up that case reports also have their value, and also talking about that whether it is good or important from the point of view of my clinical practice. So I think that's what, in fact, some of the journals also, I remember some of the journals having, and including BMJ and others, that what is already known and what this study adds or what. So that's why they, including some of the Indian journals, they also have this section where they have a box. So that's again there. And sometimes I think we need to, as authors, need to think, right? So we'll move on, and let me come to Dr. Kumar and ask him again, one of the common things which sometimes comes across the mind of people when they are just beginning, probably. So when we start writing, we've been talking about writing, how do we start, where do we start, how do I highlight? But also, when we are writing, sometimes some of us have this kind of, say, fear that I'm not good at writing. My grammar, my spellings may not be good. So, Dr. Kumar, can you just tell us, in your experience, is there any kind of support or help available? Or how do I go about grammar and spelling check? And so could you just please tell us about it?
See, the fear is good. I think the fear is good, because only when you are fearing, then you are able to, self-doubt, you can correct yourself and bring the best out of you. So with my limited experience of paper publication, I can say I usually go for the normal MS Word, where I write my first case study and everything. And then I have a superior, F7 helps a lot. And when I have my superior and a teacher or any colleague who is good into these writing of articles and everything, have them proofread it once. Then we have this publication houses who can, who go through these stuff. There are professional agencies again who help us in these kind of stuff. And then there is then one website called Grammarly, which helps, Grammarly.com, which helps us in these kind of stuff. I think I have answered it, Animesh sir. Thank you.
Okay, thank you, thank you. Any other inputs? Maybe Dr. Aditya, Dr. Praveen, maybe Dr. Murali.
Yes, I think, as a reviewer and a former editor, one of the things that puts me off completely is poor grammar, and even worse, poor spelling. The least people can do is do a spell check before you submit it. Dr. Kumar already brought out the fact that, a lot of this is already available in MS Word. If it's underlined in red, please check the spelling. New words will be added on MS Word Learns. The other is if it's underlined in green or blue, that means there's a grammatical problem, and please check it. MS Word is good. It really knows what it's doing. So please follow that before you submit it. And as he said, get professional help. There are a lot of people who will help you with the grammar. Grammarly is good. It will also help you with the plagiarism issue. Because when you, are doing your discussion, there's a great risk that you'll fall into plagiarism. And that in some journals especially is extremely dangerous. They will blacklist you if there's a lot of plagiarism. So please check before you submit it, because journals these days will always check for plagiarism. Any good quality journal will check for plagiarism.
Thank you, sir. Thank you for adding that. And very importantly, yes, plagiarism check, because most of the journals first, now they do some of these things, as Dr. Murali rightly said. They will say whether the article conforms to the prescribed guidelines, and does it have any issues with language or grammar, and then of course plagiarism, and then only it goes. That's called technical check. So thank you, sir. Dr. Praveen, I would come to you. We have a question, in fact quite a few questions from one particular Dr. Gyan Shankar Mishra from Nagpur. So let me take one of them right now, and then as we proceed. So he's asking, should data sets be uploaded along with the article? So what's your take on?
Yeah, I don't think we need to give them the raw data. None of the journals, I think not much journals will ask for the raw data unless they really want to check whether the authenticity of data is correct or not. But as of now, whatever articles I have submitted and whatever journals I'm currently reviewing, including NEJM, including Lancet, nobody will ask for the actual data set. But I have seen some people putting it as an annexure, and we ourselves tell them not required. Okay. And second question, I think I was just going through the same question that he was asking as a part of this only, what annexures we need to submit. Okay. So annexures depend on your article and also the journal. For example, if I'm submitting paper to Lancet, they want the tables, okay, to be sent as annexure. And some journals will want the table, graph, and the flow charts and the pictures to be sent as annexures. And more common annexures that we usually send are the copyright form. Okay, so authors are all going to agree that they have gone through the paper, they are agreeing to be a part of the author panel. That is what we call as a copyright form. And some of the journals will ask you to send the institutional ethics committee clearance letter. Okay, that you have taken permission or your project is approved by your institutional ethics committee. And some journals will ask for author declaration forms. Okay, that you are declaring that there are no conflict of interest involved in the study. Okay, these are few of the annexures which we usually send along with the manuscripts to the journal editors.
Thank you, Dr. Praveen. I'm hopeful that Dr. Gyan Shankar Mishra has got the answers. We'll take up some more questions from him and others in a while from now.
Dr. Murali sir has got something to tell.
Yes, definitely.
Yeah, so as I said, as Dr. Praveen said, you don't have to send all your data, but keep your data carefully. If your paper is challenged for any reason, they will ask to see your data. And one of the most difficult things, humiliating things, is to have to withdraw a paper because you've lost your data or, it's been corrupted in some form. So store it in more than one table or format, and keep it for as long as, you think it's going to be valid. Do not lose your data. I know some really good papers that have been withdrawn because people lost the data, and some very, very, key figures in our country who've been, most honest people have had their names ruined by having to withdraw a paper just because the data was corrupted or lost. So please keep it carefully.
Thank you for that tip, sir. You are absolutely right, because this has happened. And in fact, one of the, I think 90s, one of the persons, Dr. R.B. Singh, is rather infamous for this. And of course, there were a lot of other things, issues involved. And there was another issue of scientific misconduct, but he said that apparently the data was lost and it was eaten by termites and other things. So there was a huge inquiry. People came down, ICMR and the things got involved, a lot of things. Anyway, coming back to, so I think that settles that issue of actually what annexures to be added, and also to see to it that whether the data is required. But also to add my experience, BMC also wants us, and some of the journals want us to actually keep the data handy. And as you rightly said, sir, we should be ready to provide it if at all asked for. So on a reasonable request, that's the declaration some of the BMC group of journals, including Malaria Journal, where I've published a couple of articles, they want us to do. But none of them upfront ask, as Dr. Praveen said. But yes, we have to be ready for a scrutiny, and somebody, if required, should be able to take that data and then see to it that our results are valid. So moving on, now we've talked about these things, and we've talked about how exactly to go about, and you mentioned, Dr. Praveen, about certain forms, including the ethics committee. And so let me take next question to Dr. Aditya. Dr. Aditya, could you tell us, now we've just talked about certain declarations and authors and co-authors, and now who can be an author? Can anyone be an author? I mean, who are my co-authors? Who are the authors? What are the criteria that somebody needs to meet to be an author on a paper?
Basically, an author is the one who is going to contribute the most to the paper. But in our institutions, in our hospitals, in our postgraduate institutions, it's always been fixed key the HOD will have the author, main author, corresponding author, and the one who is toiling the most, the postgraduate first year, is going to have the last name. So, but there's a very, very basic set of guidelines that has been laid down by the International Committee of Medical Journal Editors. That is that each author should have participated sufficiently in the work to take public responsibility for the inappropriate portions, for the appropriate portions of the content. Second, the authorship credit should be based on a substantial contribution of conception and design of the study, the acquisition of the data or the analysis, and the interpretation of the data. Second, the drafting of the article or revising it is critically the most important responsibility of the author. And third is that final approval of the version which is to be published has to be finalized by the author only. So acquisition of funding, collection of data, or general supervision does not justify the authorship. We have to follow the certain set of guidelines for the author thing.
Right. Thank you. And as you rightly said, those three, but then they have added ICMJ that you referred to. They've added another criteria that all the authors should be able to be accountable for the manuscript, and they should be able to, if at all there was a question raised on the, say, validity, veracity, so they should be able to assist, because there were a lot of instances, and if I'm right, I think 2013 they added this criteria. So now there are four, and all four have to be met. It's an all or none kind of a thing. We can't say that, I participated in the data collection or I interpreted, but I don't want to participate in drafting and then revising or maybe approving the final manuscript to be submitted. So it has to be all of them. Any other inputs from any other panelists before we move on this particular?
Sir, and second thing, the person who has not been counted in the author list, the names, they should also be listed in the article who have been contributing to the article, like the person who has done the drafting of the thing or the typing of the thing, and they should also be given the equivalent amount of respect.
I think we temporarily, I think he's back.
Yeah.
Dr. Animesh is back.
No, he is not at back, sir. I think if you want to add anything, I request you to kindly add.
Praveen sir, can you
Dr.
take
Kumar.
up, Praveen sir, can you take up Animesh sir's
Yeah, till
response?
Animesh joins, can you take over, Dr. Praveen? Can I just add, the important thing is, first of all, Dr. Aditya, I don't think everybody follows what you said, that the HOD gets the prime authorship. That's not true. I have more than 60 papers published, and I'm first author on only one. Okay, so I conceive it, I design the study, I give it to my postgraduate to do, and I give him first authorship. I virtually rewrite the whole thing after they write it. I check all the, references and so on. And finally, I put my name if not last, maybe fourth or fifth. Okay, so I have only one paper as first author in the more than 60 papers I've published. So this is not across the board. And I know many people who follow this, these 4 rules very, very strictly. Who's been the inspiration? They should be the inspiration. They should be writing, or they should at least approve it. Sometimes it's so well written, you don't have to do very much. Okay, but you have to take responsibility and say, look, I have written it. And finally, and the most important, I think Dr. Animesh pointed out, was you have to take responsibility. I remember this famous Step-2 and Edwards, the people who came out with the, the first test tube baby. And I think Step-2 got into a lot of trouble because he approved papers that were actually had a lot of fake data. And he had not seen it, but he just lent his name to it and got into a huge amount of trouble. So when you put your name on a paper, you take responsibility for the veracity of that paper, the integrity of the paper. Very, very important. I think we have Animesh back. Dr. Animesh, sorry.
No, thank you so much. I'm so sorry. There is heavy thunder, lightning and rains here in Mangalore, and I got disconnected. There was a power failure momentarily. So thank you for carrying it forward. So I'm back. Yes. Yes. So I think very interesting discussion. I did hear your part of your answer, sir, and the discussion that you were very rightly pointing towards. Now, another question that we have now is from Dr. Ravi from Indore in Madhya Pradesh, and he is asking us whether we require to have an ethics approval. Dr. Praveen mentioned, so do we require an ethics approval for all the publications, or is it selective? So, Dr. Praveen, would you like to add on that?
Sir, I think you are the best person to answer this question. I will add after you talk. Yes.
Okay. So yes, Dr. Ravi and audience, yes, for any kind of research, we do require ethics approval. So we do require, and this has to be done prior to starting the study, including the research which is done on the records which are there in the hospital MRD, that is Medical Records Department. We do need to. So what ICMR says, and I would say that, we need to refer to the ICMR guidelines, the latest one, 2017 guidelines, very nicely laid out. Keep it handy as a PDF document, download it. But just in a nutshell, any kind of research which involves any kind of human data, be it some kind of reports, their pathological or any other tissue specimens, or it could be even their data in the form of survey questionnaire, or if you're doing some intervention, definitely. So any of these will require. And if in doubt, it's better to put it to the ethics committee, let them review. If in case we want a waiver of anything, including informed consent or any other thing, that has to go through ethics committee. As an investigator, the moment I become a researcher or investigator, I cannot decide that yes, this doesn't require, this doesn't have any kind of ethical violation. That has to go through the institutional ethics committee. So that's my answer quickly. Praveen, you want to add something?
I think that is quite precise. We need, because I will start from the other end. Sometimes we get the papers and we request the authors kindly send the institutional ethics committee clearance, and the arguments begin. Authors start arguing this was a record analysis, so this doesn't require ethics committee clearance. And then we send the link of 2017 ICMR guidelines, but they send one more article back to us saying that in this article they have not taken ethics committee clearance. So this will keep happening for quite some time, but at the end of the day we reject the article saying that there is no institutional ethics committee clearance. So please keep in the mind, if we do send any paper without institutional ethics committee clearance, the paper will get rejected. Okay, so keep that thing in mind. Please always take ethics committee clearance before you begin the study, and a copy of it should be preserved religiously, and it should be given to the publishers whenever it is, as a part of the annexure. And in the body of the methodology, it is a very good practice to mention the reference number of institutional ethics committee clearance. It itself is going to solve a lot of problem. It adds the authenticity to the paper. Thank you.
Absolutely. Thank you for telling us that. In fact, many of these journals, including a couple of years back itself, some of our neighboring country like Nepal, some of the journals have insisted on ethics committee approval to be uploaded. We have followed suit a little later in most of the journals, but yes, so that's the experience that we have. Now, going forward, again, there are some questions. So before I take on the question, I just wanted to know about how do we go about selecting a journal? Do you touched on it, Praveen, but I think we will still get some kind of idea. And then I would like Dr. Murli and you to respond predominantly to this question, that how do we select a journal for a manuscript that I have in mind, or I already have drafted it, or maybe I'm planning to draft with the research that I have. And how do we avoid those journals maybe which we now call as predatory journals? So that's something which I would like you to shed some light on. So Dr. Murli
Dr.
first.
Praveen, you want to start?
No, sir. I think you can start it and then I will.
Sure. So basically, when we're talking about predatory journals, that's the first thing to do: avoid predatory journals. I mean, it's a very nice term that was coined some time ago. A predator goes out and hunts down prey. Okay, which is why it's called a predator, and that's what journals like the omics stable of journals do. They send out messages every day. We get it on our mail saying publish here, publish here. That's a good sign that this is a predatory journal. Okay, you'll never find NEJM saying please send us your articles. You will never find Lung India saying please send us your articles. So nobody hunts for these, and the main reason for the existence of the journals is to make money. So you'll be spending huge amounts of money to get your article published. So these are some of the characteristics of journals. But I think the first time you see some journal asking for your articles and saying we will publish it in the shortest turnaround time and so on, your antenna should raise and say, I'm going to be very careful about these journals. There are lists of predatory journals, so check them out. So they may sound very good. They may sound like they have an elite panel of editors and, on the board and so on. Be careful of them. I know one of my seniors was on the board of one of these journals without even knowing that he was one of these journals. Okay, so you've got to be careful about that. How do you go about choosing a journal? I think, first of all, don't go only by the impact factor. Of course, impact factor is important. Prestige of the journal is important. Both, you will look at. But the more important thing is, does the journal reflect what your interest is? There's no point in trying to publish in Lung India, for example, something on ingrowing toenail. I mean, to give you a very extreme example, okay? Whereas an ingrowing toenail may be an important thing in either surgery or dermatology. So choose your journal appropriately. There are some journals which will give you a wide variety of, interests. For example, NEJM has a wide variety of interests, okay? 3, don't aim too high, okay? My suggestion is start with, getting used to journals, getting used to the whole process of writing, and, choose a journal appropriately, which you think is reflective of your interest and the interest of the readership who are reading that journal, okay? And finally, look at the costs of publication. Now that the Indian, Medical Council of India initially, and now the NMC has made it mandatory, we find more and more people just want to get publications in and are going to predatory journals. If you look at the list of, on the CV of people, most of these journals don't carry any value. Okay, so be very careful about that. Okay, I'm going to stop at this point and hand over to Dr. Praveen.
Thank you. I think you have covered most of the points which I wanted to share. And one point of caution, there may be some faculty who want to be the reviewers of some of the journals. And when you get any invitation to be in the editorial board of any of the journals, please keep in mind what Dr. Murli sir was making a mention. Please do not join the editorial boards of the predatory journals. I'll tell you one experience. One of the journal for which I'm consulting, they suddenly got a mail from Scopus that kindly give a clarification that few of your editorial board members are also editorial board members for some predatory journals. Why should we not cancel your indexing? Okay, so the journals will have a lot of even though they are maintaining a very good track record, and if we join in some journal in a journal which is predatory as an editorial board member, it may reflect bad for the journals which are actually performing well. Okay, and as sir has aptly mentioned, please identify who are your target readers. that decides to which journal you need to send. There are some websites available. You can upload your abstract, and the website itself is going to give the list of journals which are publishing papers with this particular mesh terminology. So you can use that particular thing also, and always keep in mind, check the quality of the journal before you submit. And always, as sir mentioned, start from the beginning, but don't stick on to that, because what happens is we get used to it when we start submitting a paper to some journals, and where the review process is very less and you get article accepted, and it becomes a kind of a habit. And when you send article to the journals which have a elaborate review mechanism, then you start feeling offended. When I sent to that journal, they easily accepted it, yeah, and these people are sending 100 review comments. So that become, don't make it as a habit. Okay, and always try to improve your graph. It should grow further and further, and your target should grow high and high, so that you can reach to the heights. This is what is what is from my end. Thank you.
Thank you. Thank you. There is also a question, I think, which you've already answered. So Dr. Gyan Shankar Mishra had put up another question saying that, what about, should we bother about indexing, or should we bother about the impact factor, or should we go for an open access versus an impact factor, good high impact factor? So I think that's already answered. Just to share another facet, what Praveen said, in fact, sometime back, a couple of years back, I was amused. I have this habit once in a while, at least couple of months or sometimes once or twice in a year, I do Google myself. And I'll tell you, sometimes you learn interesting things about yourself if you Google yourself. And that's what happened with me. I found myself to be on an editorial board of some journal which I never had heard of. And then I wrote to them, and you know what was their reply? They said, "Sir, please send your CV, we'll add you." I said, "Thank you, but I don't know you," because it was a predatory journal. And they had put my name correctly, my professor of community medicine, but they had affiliated me with some other institution which I had never been a part of, because I've always been with KMC for like 17 and a half years. So, interesting things you discover. And as you rightly said, thankfully, I don't know, maybe some other journals which I was associated, they did not get a letter, I hope, from Scopus, like what you said. So that's just for humor, but that really happened. Now let's move on. We've been talking about so many things, but I want to again go back to one of the basic things where people find it difficult. Now, I'll come to Dr. Kumar. I think he's been quiet for some time, so let's get him involved as well. So, Dr. Kumar, what do you think is the role of reference manager? Many times when we are writing references and then we send it to one journal and then they said, no, change it to this style, or some other journal, when it gets rejected and comes back and then we have to submit to another journal, they may have a different kind of style, Harvard style, or maybe a Vancouver. Vancouver is the most common. Sometimes, again, if we want to add, sometimes journals will say, no, you must add some more latest reference. So what is the role for reference manager? And can you share some tips from whatever experience you have about how do we go about selecting one, or do you have some suggestions?
So you have actually hit where it hurts the most, and references are the most painful thing. While it's even easy to write your case study and a case series, but it is much more difficult to index the references, and that is where problem usually comes to us, and we have to sort it out. So nowadays, with God's grace, there are two websites which are much commonly used across the world by a lot of people. That is, one of them is Mendeley, second one is Zotero. Both of them are being frequently used. As I was attending one of the programs of this international organization where they teach how to do research. So they were telling us about Mendeley, and I had no clue about it before that. And they told me about it, and then also again, and they were telling them Vancouver style में लिखना है. Vancouver style क्या होती है? So like keep on reading, keep on learning from people, and that's how it is. I'll rather have so these two reference managers are most commonly, I think, used by people across the world. I guess all the researchers use Zotero and Mendeley for referencing. Referencing does matter. It just shows how the more references you have, the more authentic your article looks. That's what it is. I'll have Dr. Praveen add something to it.
Dr. Praveen?
Yes, sir, I do really agree. These are the softwares which really make our lives easy, but we need to be really, we need to learn how to do it, and then we need to practice it. And and it is also going to, help us a lot, because while we are writing, we read something and we will paraphrase it and write, and then we will forget from where we take. And we used to have a practice of writing after the sentence, putting it in a red font. This was taken from this reference, and later on we used to list. So now people are advancing. We can use either Mendeley is a very good software. We can definitely use it. And coming to the second part, references, the list of references. I had come across one of the paper. With the paper, the length of the entire paper was 3,000 words, and the list of references were more than 220. So this will be actually very difficult for the journal publishers also. And I know all the content they have taken from those 220 papers related, to some extent related, unrelated. They will merge everything and put it there. But the problem is, how many are actually precise? How many are actually required? Please keep in mind how much is, if 220 references are multiply repeating the same sentence or same kind of a message, keep the one which is most relevant, and you can remove rest of the things. So it doesn't decide. The long list of references may not be a deciding factor for the authenticity of the paper, unless the content taken is authentic and the information is paraphrased in an appropriate manner.
Thank you, Dr. Praveen. Murali sir, do you want to add something, some pearls of wisdom?
No, I think he said everything very clearly. The references have always been a bugbear for me. I started writing in an era where we didn't have anything on, we had to go to the Index Medicus, page by page, select the articles we wanted, go to the journal, library journal section, and you'll find that particular journal is missing, or that particular sheet has been torn out by some postgraduate before you. So, I mean, I'm very envious of the current generation who can Google these things and get it all. So I'll leave it to what Dr. Praveen said. I've grown up the hard way. But I mean, I think nothing can replace the importance of having a good reference manager. In fact, I'd like to ask Dr. Praveen, you spoke about Mendeley. How does Zotero perform? One of my persons who helps us is very, very fond of Zotero, and he's been training us in using Zotero.
It's equally good, sir. There is no problem with the Zotero also. Both of them are actually performing really well, and many people are using it. I think both can be used. Yeah.
Sir, it's an individual preference, if I may add. So both are equally good. Both are free. That's one of the advantages, and both work equally well, and they give you lots of features. However, many people prefer Mendeley over the other, and same is the case also with Zotero. Now, Mendeley, there is a minor advantage. I don't have the comparison chart, but we have like a minor advantage, but both are equally good. And the best thing is both have compatibility with Word. So we can work on Word documents, and then there is a plugin which you can download with, especially Mendeley. I have some experience. So it becomes very easy. And at a click of button, you can actually change to any of the styles. If there is a style which is not there already inbuilt, you can download that as well. So those are things which are, so definitely, but any of these can be used. Many of the Western people, Western universities, they prefer using EndNote, but this is like a paid one. I mean, that's a bot licensed one, which is expensive. So Mendeley does the job, and it helps us organize. It can also have another advantage is that we can have online storage, and we can retrieve it anywhere that we want. We don't have to have our own system. Like if I'm working on my laptop, I go elsewhere, I'm not carrying mine. I just log into my Mendeley. I have all my references there in the order that I have, and I can have multiple. So if I'm working on, say, 3, 4, 5 papers, all of them can be put up in different folders. So it makes life easier. You rightly said. I remember my PG days, sir. that we used to hunt in the library. Of course, you would have had much more difficulties, but yes, I also remember that we used to really struggle, and that has happened with us also, where that particular page is missing, and you feel so annoyed and irritated, and then getting those journals, because most of them are sometimes very rare copies or foreign journals, it was so difficult. Right. So,
Can I
Dr.
just add,
Aditya.
I use a Mac OS.
Yes, sir.
I think Mendeley is available for Mac OS also,
Yes,
which
it
I
is, sir.
don't think Zotero is. I have not tried recently. Is Zotero available for Mac?
Not very sure. Maybe Dr. Praveen can add. I know that Mac OS Mendeley is definitely available.
Yeah. So,
I'm not very sure about it.
Okay. All right. So we'll look up that. And let me come back to Dr. Aditya. And Dr. Aditya, we've been talking about so many things, and I think there was a reference which came to NMC guidelines of mandatory publications. So just, probably to like, see what are your views, and then we'll probably open it to the house as well. So what do you think about the current requirements of publication for teaching faculty in academic institutions?
So the teaching faculty, according to the NMC has laid down very, very perfect guidelines for who can be labeled as a professor in a medical college or associate professor and an assistant professor. A professor is the one who is having 8 years of post PG experience with a postgraduate qualification of MD/MS in the concerned subject, with 4 research publications in the index journals on cumulative basis, with minimum of 2 research publications during the tenure of the associate professor as first author or as a corresponding author. And he should be associate professor in the same subject for 3 years. Second thing, an associate professor is the one who is having 5 years post PG experience with a postgraduate qualification of MD/MS, with 4 years of teaching in the same subject and 2 research publication in index journals as first author or as a corresponding author. And third is the assistant professor. He should be a he should be holding a postgraduate qualification of MD or MS with 3 years junior residency in a recognized medical college in the concerned subject and 1 year as a senior resident in the concerned subject. So, professor and associate professor are the one who have been classified by the NMC according to the research publications. And second thing is the for the super specialization, the it goes the same.
Right. So those are the requirements. So as you would see that even for faculty in academic institution, there is a mandatory requirement, and especially at the different levels. So even for promotions, that's a requirement. Again, yes. And again, there are people who feel that that requirement is not. So we'll not go into that debate. But any other views on this particular thing? Dr. Murali, Dr. Kumar, Dr. Praveen.
I would find it difficult to get adequate number of papers of mine accepted by the NMC. As I said, I put my name at the last or second last, and I think that's a bit unfair, but we won't go into it. So something I learned much later is, even if you're not the first author, it doesn't matter. Put yourself down as the corresponding author, because anyway, you're better qualified than your postgraduate to respond to questions that come in, comments that come in. So it's a good idea to either be the first, if you're not the first author, which I think is the right thing to do, is to give it to the postgraduate who's done all the hard work, or your colleague who's taken a lot of trouble collecting the data and so on. Even if you've given the idea, you've designed the study, but then you should probably at least make sure you're the corresponding author. But I think now they allow that the first 3 authors are accepted. So just make sure that you're one of the first 3 authors. I was always the last author. And, unless people know your name, they don't even know you're associated with it, because most references will either, have, the first author et al. Or the first 3 authors et al. Or some will generously give 6 authors et al. And if you're the 7th or 8th, you lose out completely. So be a little careful. I'm not saying be selfish, but, have an eye to what your CV should show also. I learned that lesson too late, right at the end of my career.
Right, sir. That's nice way of putting it. I'm sure that you are much beyond this, definitely. But yeah, coming back to it, I think you rightly said that But as you know, sir, that there is a convention, especially in the Western systems, where the senior most author usually is the last one. That's what I've seen, especially when it's doctoral work or any of the postgraduate or whatever work. We've collaborated with some of the people in Germany and other places. They usually do that. So the senior most person is the most, say, responsible person, and as you rightly said, would be usually the last and probably sometimes even the corresponding author most of the times. So that's what they do by convention. Hopefully, we will also get into that. And very rightly put, sir, the postgraduate usually, especially in our university, usually the work of the students, we give them the first authorship. I think Dr. Aditya was mentioning initially about other people getting the credit, but yes, that's there definitely. And since while we are on the subject, you brought in, first three and others, and of course there have been a lot of changes to that policy, and that has also resulted in some people having difficulties. But what would be the ideal way to decide on the order of authorship? Since we've discussed, any views on that? There are some set of guidelines which do help, but any thoughts, any practical suggestions from our panelists, maybe Dr. Praveen, Dr. Murali, Dr. Aditya, in that order?
Yeah,
Praveen?
thank you very much for that question, sir. I think we have already discussed quite a bit about it as per the guidelines laid out by ICJME. So, who is going to be the author and what is their contribution? We can rate it, and based on the one who receives the highest rate can be arranged in that particular order. I think it all depends. There are many solutions for it. We were discussing the head of the department will be getting the first authorship, or the mentor will be getting the first authorship. There are ways in which we can make it a win-win situation. So if we, at the time of designing our dissertation or the thesis itself, if we do it something like there can be two main papers which come out of it. So in the first paper, the mentor can be the first author, and the student can be the second or corresponding author. And in the second paper, it can be vice versa. So there are many models and many ways in which it can be thought of. But my view on arranging how we decide the sequence of authorship is again based on the level of contribution of the author panel towards the execution, towards the conceptualization, execution, and analysis, and writing the manuscript, and of course, reviewing it.
Thank you. Sir, Murali, sir.
So one of the things recently, for example, we all contributed. It's a multi-center, multi-author paper from different centers. This was the Embark study. And they fairly went simply by how many cases did each center contribute and who is the principal author there from that center, and one more author they allowed, which I think was very fair. And this was laid out at the beginning, before the whole project started. And that's a very good idea. If you want to, avoid heartburn at the end, decide in the beginning and say, you will get authorship, and your order of authorship will be decided by how many cases you contribute, completed cases. People will contribute part of it and then drop out on all the follow-ups. That would not count. So, that should be laid out right in the beginning. Otherwise, it can lead to a lot of difficulties later. On this, I think Dr. Gyanendra has asked another question about publishing multiple papers with the same set salami publications. Clearly not to be done, but you can bring in a different aspect for two different journals, completely using the same data, but focusing on a completely different aspect based on the interest of that journal. I think that's fine. But it is a different paper. It needs to be written completely differently with a different viewpoint. Then using the same data set is fine. In fact, I think they've said that when you do your PhD, you should get at least 6 papers out of it. I think any data you collect you should be able to get, if not one, at least, if not 2 papers, at least 1 paper, but try and get at least 2 papers out of every, project that you do. But again, going back to what, Dr. Praveen said in the beginning, that should be cleared by the ethics committee. You should make it fairly clear to the ethics committee that, you plan to bring out these 2 parts of it. And you will be publishing, hoping to publish 2, you'll be writing up at least 2. It may get published or not published. That's a different issue. But you will be writing up 2 papers. And again, something I wanted to say earlier is, having been on both sides of the ethics committee, I've been on the ethics committee, I've been on, presenting to the ethics committee. The role of an ethics committee is to protect you. It is not an adversarial role. Most people have this concept that, they're trying to block me and they don't understand and so on. They're actually trying to protect you. They're trying to protect the subjects of the study, most importantly, but equally, they're trying to protect you from future problems. So please respond to them. Don't think they're trying to block everything that you do. And they may actually make your study much better with their suggestions. So, take their role seriously and respectfully.
Thank you, sir. I think that was very, very valid and very nicely you added. I think that was a very good thing that you brought up, that it should be pre-decided. In fact, that's what I wanted it to also come up. So usually in a good way, if you want to go about, or the ideal way, it would be pre-decided. So we decide on, and if you're planning on multiple, because if you have a huge data and you have multiple facets, which rightly answered by sir, that we don't do that salami, that is, break it down into just for the sake of making papers, as Dr. Gyan Shankar has already asked. So what we need to do is, we need to see that we are presenting a different facet and we don't repeat our data. So that's acceptable. Otherwise, salami is not. And our experience also has been, sir, we had done some collaborative work with some German researchers. So they had already said that for molecular part, we'll take the lead. For epidemiological part, like we will take the lead. For clinical, some papers, some of our clinical colleagues. So it was pre-decided. We've already come out with 4 or 5 papers. So, and they have stuck to that agreement. So that's something, it's obviously when we collaborate, and it's we have to see to it that we stick to our words, because otherwise future collaborations can also suffer. So these are some of the things that we need to decide right in the beginning. And I think that's nice. I would just quickly take 2 more or 1 more question that Dr. Gyan Shankar had put up. Just he says that what about this gift authorship and ghost authorship? Is it ethical? Or so obviously that's not ethical, and it's definitely not something which can be really approved of. So as you rightly said, gift means we are giving somebody a gift of authorship without that person actually doing something. And ghost authorship, just for the benefit of viewers, is something like a ghost. You don't see a ghost. So that means the person has done the work, but he's disappeared on the paper. The name doesn't come. So you don't see that person. And that's the easiest way I can tell you that you can remember ghost authorship. So suppose, we all work together, and I decide that, say maybe Dr. Aditya or Praveen, no offense meant Dr. Aditya, just for example. So I say that I won't put his name, and he has really slogged. So that he becomes a ghost author. So obviously that practice is not to be encouraged, and
more
that's
dangerous
not
kind of ghost authorship is when you're writing something for a drug trial, and somebody, the company has written it, and they've slanted it completely in favor of the company, and that's even more dangerous.
Yes. And then again, what happens is, sir, they put somebody else's name to make it more credible. So all those things happen. You rightly said that. So yes, I think we've had, and I just wanted to inform that we've had more than, I'm not sure how many now, but we had crossed 900 odd logins about half an hour back. Dr. Krishna informed me, as he was very appreciative. So a couple of more questions before we probably wind up. We have a couple of minutes, 12 minutes to be precise. We'll take a few more questions and we'll just see how we make it more meaningful for the viewers. So Dr. Praveen, I'll come back to you. A lot of things you did explain in your presentation, but I have a few questions. See, what is the role of a statistician, and when do we involve that statistician in our study? And how do we go about, taking his or her assistance, and then what do we tell them? Can you just quickly tell us, so that, because this is again one of the confusion, and again, how do we decide whether they should be author or not? I know that we've discussed this, but just on this particular aspect of statistician.
Thank you very much, sir. This is a very important question. So we often face, being epidemiologists, we put both the hats. Sometimes people call us as statisticians also. Sir. Hello, sir. Am I calling to statistician? So point is, we should involve statistician from the beginning of the study, at the time of conceptualization. And they are the one who are going to tell us what is going to be our sample size. Okay, so please keep in mind we have to consult statistician about the sample size estimation, and when you go to him or her about estimating the sample size, please carry some literature with you. Okay, so if it is a prevalence based study, or if it is a trial, or if it could be a case control cohort, please go with the clear idea about what is the outcome of your study. Okay, and for that have some literature with you, and when you consult them, because they may not be completely medical people like me and our audience, they are having the biostatistics background, so we need to explain them what is the meaning of pulmonary embolism. They may not be having an idea about it. What is the meaning of deep vein thrombosis? We need to tell. This has happened with one of our student. He went to a statistician and asked, so what is the incidence of deep vein thrombosis among patients undergoing major surgeries? He did not have idea about it. So he calculated 100 karke, 100, do 100. And when the student came to us, he had collected 99 subjects and he did not get one deep vein thrombosis also. And when he came and asked, what can I do? Because if deep vein thrombosis among major surgeries is quite a low incidence component, so you need to have thousands of subjects for that. So the statistician may not be knowing about it. You need to tell them what it is. And coming to the second part, show your tool for data collection to the statistician. Number one, you have talked to them about the sample size estimation, and you showed them your objectives or outcomes of your study, and then ask them the tool for data collection, whether this is a measurable tool. Whatever outcome we get out of this tool, are they going to be measurable? And after that, you start the data collection. Enter first 10 data, show the Excel sheet to the biostatistician, and ask whether the data entry is correct or not, whether I am maintaining a proper entry or not. And after that, go to the statistician at the time of analysis of the data. This will make statistician also feel happy that you have involved his inputs from the beginning, and also he is having sufficient amount of knowledge and information about your study. And always tell him what is the outcome required from the analysis. The students often come to us with voluminous raw tables generated from SPSS, SAS, or Stata R, and they don't know how to interpret it. After they generate the table, sit with the statistician and interpret your results. And definitely when you write your paper, statistician will be one of the reviewer to check whether, in qualitative research we call it as a member checking, so they will check whether the interpretation is correct or not. And if you have included them in all the process, they definitely deserve an authorship. Please give their due. This is all from my end. Thank you.
Thank you, Praveen. Thank you. I think that kind of comprehensively answers that query, and I'm sure that people have been guided by that. So, Dr. Kumar, can you please tell us what do we do? We've submitted very enthusiastically to a journal, and the paper comes back with comments, reviewers' comments. Or in other instance, maybe if we are not so fortunate, it comes back rejected. It's not acceptable to the journal. So what do we do?
Story. I'll have Dr. Praveen answer this question for me.
Oh, okay. Praveen, you are muted.
Yeah, thank you, Dr. Kumar. I wanted to answer this question. Thanks for giving it to me. Once you get the list of reviews, take a deep breath, read them, okay, and then have a cup of coffee. Never get offended because someone is commenting on your baby, because your manuscript is your baby, and if someone is commenting on it, you are the first one to get offended. Please don't get offended. Don't take it too much to the heart. Reviewers are also human beings, and once you read all the comments, okay, it might have got rejected. If it gets rejected, find out the reason why it has got rejected. They would have definitely mentioned some points why this paper is not acceptable for their journal and what are the flaws in that. Sit with your panel of authors, find out how you can solve these problems. And if they're really solvable, sometimes papers are rejected for the reason that the sample size is not sufficient. At that point in time, you cannot go back and collect the sample. So whatever is available with that, whatever best you can bring, that you need to really think of. Okay, then find no, each and every comment need to be addressed with a point wise clarification. What is the answer? What is your answer for that particular question? Always be polite in answering, and do not be very harsh in your reply also. How can you make this kind of a comment on my paper? It is fine. Okay, you need to be a bit polite and when you are answering to it, and answer all the queries as much as possible. And if something is not feasible, as I have mentioned, politely mention it, and you need not reply to that particular comment. So this is all. When we get the authorship, reviews will come. If the reviews will definitely improve the quality of the paper, what we usually do is we send the paper to the best possible journal, and they will definitely reject it, and they will reject with so many comments, and utilize those comments as an opportunity, improvise your paper, then send it to the next level journal. So this is we need to really enjoy this process rather than getting disheartened. Thank you.
So that's a very positive note, Praveen. Thank you. Let me take some views from Murli sir as well.
No, I mean, I think Dr. Praveen has covered it beautifully. I'll just tell you, the first time I, learned of the importance of this is when Dr. Janardhan Reddy is currently head of the Department of Psychiatry in NIMHANS. He was giving us a talk on this, and he says the most valuable paper he wrote was the one that got rejected first. And from the comments, he learned how to write a paper much, much better. And after that, after he followed those suggestions and followed the same, he's never had a paper rejected. Okay, it's come back with comments, of course. It will come back with comments, and you should use that, as he said, as Dr. Praveen said, as an opportunity to improve. But it is really one of the most valuable things to look at the comments, why something was rejected or what they want you to improve in the review process. I mean, so don't get hurt, as he said. It's such a valuable thing.
So
and
absolutely,
the only other thing is, after you go through the review process, please remember to send it to all your authors. Okay, all your authors should be involved in that. You can't make changes, send it off without involving them, because that's actually unethical.
That's a very, very valid point, sir, and very, very important suggestion. And as you rightly said, sir, I had this experience in about early part of 2006, 2005, and in 2006. The first paper where I got published in a very good journal, Elsevier journal, but it was rejected 6 times before that. And then finally it made it. And again, with huge number of, I think the first time it came back, it had almost about 4 pages of comments. And I was quite terrified. But then, as you rightly said, so we have to see it as an opportunity to improve, which Dr. Praveen also stressed on. So I think that's very, very
I'll remind you that J.K. Rowling got about 21 rejections before Harry Potter got accepted. So
right, absolutely. So that's the way we have to, think positively. So before we end, I would like to have 2 quick questions. One is, now we've been talking mainly on these research related to original research, but I would want to bring in a perspective about case reports and also review articles. So first, Dr. Murali, and then I'll take on the views of other panelists. So this is one question which I thought we should touch on. And I'm sure that this has its own importance when we are trying to build evidence, and we'll not go into systematic review and meta-analysis for this particular episode. But then these two definitely have value. And Murali sir, case reports and review articles.
So case reports are a very useful way to start writing. Because you have one case, you have a short case series. It doesn't qualify for a major paper, but it gets you into the practice of writing. It gets you into the practice of reviewing the literature associated with that particular case or cases. And it just gives you experience in writing it properly. Obviously, the plan you will follow, the map that you will follow is different for a case report as compared to an original paper. But it still is a very, very valuable thing. And I think it should be encouraged. We should encourage our postgraduates to start writing case reports and expand into, proceeding into major articles. Reviews, again, are when you don't have that, but there's a contemporary topic of contemporary interest. Very important to write these reviews. Again, gives you practice in evaluating the available literature, collating it, putting in your own perspective on it, which, is valuable, especially when you combine with a senior author who can add his perspective to it and write those reviews. So I would say, as important, not as important, but important is also case reports. Short case series are even more valuable, and reviews have their own value. So please get used to writing all three. Each of them calls for a slightly different skill set. Each of them calls for a slightly different way of doing it, but all are equally valuable in terms of, reading a journal and getting your name familiar with the publishers, with the editor. You write a very good review, he's looking forward to reading something else from you. So when you write you send him an original paper, he's already knows your name, that you've written it well. So he's more willing to accept something from you and send it on to a good reviewer who, will give you good comments. So start by writing those. I think it's a very, very valuable exercise.
Yes, thank you, sir. Dr. Aditya, would you like to add something? Maybe if not from the perspective of writing, but how it has influenced your practice in some way sometimes, or maybe how you got some information that you were looking for when you read one of these. That perspective could also be useful.
Basically, all three things are different styles of writing, and these all should be practiced. Each has their equal individual importance. The case reports are equally important when you are in a clinical practice, in a private clinical practice. You don't have much time of conducting the studies on many things, but case reports, you definitely come across very interesting cases, and you definitely want to publish them and get a recognition also. So what are we into? Because being private clinicians, we are more in publishing the case reports and review articles, but the studies have equal importance. They increase your intellectual knowledge and also the conceptualization of the study. How do you frame the whole study? How do you go around it? So the person should be acquainted to all the three styles of writing.
Right. So thank you. Any other perspective before we take the next question, the last one?
Kumar is back, I think.
Any other perspective from anyone?
Every case report adds to the available literature. So, we spoke initially, I think Dr. Aditya or Dr. Kumar spoke about, it may be rare, but need not be the exclusive very first report. It can be the 10th case report. But, everything adds knowledge, adds to the knowledge. Obviously, the person who published it the very first recognition that this is an unusual sign or a rare presentation of a common condition will have more recognition. But every time you add, it just firms up the data, makes the evidence stronger. So I think it's very valuable. Scientifically also, not just for yourself.
I just want to talk about the review articles. I think clinicians have already spoken about the case reports. Review articles, as Dr. Murali sir was making a mention. So it is a good exercise to begin with. But the most important thing is it should be actually a review article. I have seen people writing review articles out of PG, seminar presentations. Okay, so during the PG seminar, the PG would have collected so much of information from different places, and everything is put as a PowerPoint. They copy PowerPoint, paste it, and send it as a review paper. There is no intellectual, input in that particular thing. So when we are writing the review articles, please keep in mind that there should be some amount of interpretation of the data that has already been that is put in the paper, and also there should be some valid conclusions. Okay, and there should be some kind of a discussion that should take place there. So please keep in mind, only copying and pasting something from the different sources will not make it as a review article. There should be we need to follow some guidelines, like we have something called Prisma guideline for writing the systematic reviews, and it should get vetted by the experts. They should give their inputs. So then only it really becomes a review article. So it's a matter of caution. That's all from me.
So that's an editor talking, and from the experience, as I understand, right? So yes, that brings me to the last question. Now, I think we have had a very good discussion. Of course, we can go on, but I would like the views of the House on what is the importance of having a good research team. I'm sure that by now we have realized that we have different people doing different things. So, what's the importance of having a good research team, and what are the things that we should keep in mind when we are assembling or we are building a research team? Uh, Anyone who would like to go first can go and then continue with others. Dr. Kumar, you want to start since you are back? We're still not able to hear you, Dr. Kumar. No, we are not able to hear you. Okay, I think by the time he fixes, maybe we can start with Dr. Praveen or Dr. Aditya.
So basically, what you said is the most important thing. Every individual who is contributing in the study is the important one. Like you see a watch, each and every screw, page, everything that moves does not move. A spring also has its own importance. Agar ek bhi spring nikla, it will stop working. So basically, a research study to be a good study and to be contributing to the scientific content to the people, everybody should contribute and everybody is playing role is important. Maybe the author, maybe the co-author, maybe the PG, maybe the who is doing the research work, who is typing, who is checking the grammar, and the biostatistician who gives out the results according to you. But it's his own professional experience that gives the shape of the results.
Right. Praveen?
This is a very common problem we most of the time face. What constitutes a good team? So a good team, as Dr. Aditya was making a mention, has got people with different competencies and they will add together to the final outcome. So point is, when we just start with a team which is having only the people who are having good administrative control and so-called what we call as quite experienced in that area, then it will be difficult to have getting the work extracted from them and completing the task. We should have all levels of the members from different teams. The experienced people will add their experience, they will add their inputs. The mid-level faculty will help in the data collection and analysis and writing the manuscript, and the early level faculty will be helping in the data collection. And each one of them will be contributing. I think in medical education, we define a team. What is a team? A team is a group of individuals having different competencies and working towards achieving a goal, a pre-decided goal. So what is our pre-decided goal? Is to publish a good quality paper. All the people with different competencies at different levels of their academic tenure, if they come, and research tenure, if they come together, it constitutes a good team.
Murali, sir.
No, I think that was brilliantly said. I'll only point out that when you have a good mentor, he makes the whole team come together. And to me, that's a very, very important thing. We've had, I got my initial training in research, not in India really. We did it only as a part of our dissertations and, practically did everything on our own. But in the UK, we had some brilliant people helping us, and you really realize. So we had the consultants, we had research nurses, we had research registrars, we had our clinical registrars, which I was one of, and everybody gets involved, as Dr. Praveen said, at different levels, and the whole thing meshes together beautifully so that you can come out with regular papers, case reports. So really you need somebody, and this team grows over time. Different components of it get replaced, but the ethos of the team continues as long as you built a good team to start with. Many of them were non-clinicians. We had 2 research nurses, for example, and who knew a lot about research because they'd spent time with the team, and they really were the common element of the team apart from the consultants, whereas us registrars kept coming and going, and papers continue to be published even after you leave. And they're kind enough to include you in the publication part of it. So I think the most important is to have, as Dr. Praveen brilliantly said, a common goal. And if you have that common goal, it's a predefined goal, and you can work towards that. That really is what keeps the team together.
Are you able to hear me now?
Yes.
Yes.
Okay.
Yes.
Sorry, Animesh sir. Sorry for
not
the
at all.
mess up. Just want to add one point that the leadership role of a research team, like what you have done for us today. Thank you so much. And I am in a team. I am in a team as a bottom feeders are there, and there are some who are on the top. So I'll take my role very appropriately here. And most important thing is the role assignment of every person. I feel in a team, in a research team also, you can have star players and have star performers, but you need somebody to do the scut work. So these you have an equal importance should be given to the role assignment of the people also in a research team. And it takes time to build one, like it takes time to build people around us. It takes time to build a cricket team. Anything good requires your time and patience and personal interest into these things. Thank you.
Thank you. Thank you. So,
Sir, I just want
yes.
to add to Dr. Kumar. This delegation of responsibility is very important, and it should be done at the beginning of the study itself. So, in clinical
Definitely.
trials, we'll be having the delegation log, and each person is delegated a particular work, and each one is responsible for whatever happens there. But of course, PI will keep an eye on it. And second point is sustaining the motivation level of this team throughout a particular project. So sometimes it will be very difficult. I faced this problem in one of my trials, a very prestigious trial in the country. And when we started that particular trial, 20 people were behind me, always asking, what shall I do, sir? What shall I do, sir? What shall I do, sir? And when trial was half over, 25% people were left. When it was a closeout, only me and my chief coordinator. So point is, keeping the level of motivation and keeping their involvement through it. Doesn't mean that I might have failed in my duty, but point is the way in which people take it as their responsibility and move further. That is also very important. It is a two-way relationship between the team members and the team leader. Thank you.
Thank you. So just to sum up that whole discussion, complementary abilities and the team should gel well, and there should be mentoring. So that takes it forward. And then the common goal, that's something which is the motto, that everybody works towards that. So I think that's very important. Before I ask everybody to give us probably a take-home message from each of you, I would just take one question again. Dr. Gyan Shankar Mishra had asked, since we were discussing about that salami. So he said sometimes the demographic profile may be duplicated or repeated in multiple papers from the same data set. Will this be an issue? So Dr. Gyan Shankar Mishra, as we already said, it will not. But in case you have to keep the same demographics, you can always refer to the paper which is earlier published, and you can say that this is a part of that study, and that should be acceptable. That's generally the norm. That wouldn't be an issue, as long as you say that or you acknowledge, because you would have seen from larger studies, sometimes multiple papers come and then they always reference it to that study. So with that, let me just close this with a message from each of you. So let me go to Dr. Kumar first. Dr. Kumar, what's your take-home message, or what's something that you want the viewers to retain from this webinar from your end?
Yeah, be a learner always, and be humble, and people will keep on. There'll be a time this humbleness and your learnedness will take you places. That's my thing. That's my thing, I guess.
Thank you. So be humble. Dr. Aditya.
Sir, basically nowadays there is a very good the views are going upon the quality and the quantity of the content. कि क्वालिटी ज्यादा अच्छा होना चाहिए कि क्वांटिटी ज्यादा होना चाहिए अपना पेपर के अंदर या आपके उसमें. So according to me this question is flawed. So if you know that yin and yang, they represent the opposite sides of everything. Their position keeps on changing but balancing. Yin and yang is very essential for maintaining the vitality and the vigor of the paper. So both are important, quantity and quality, and each should be given the equal importance, and none should be exceeded. Over nahi karna.
So excess of anything is bad, to be precise, and you have to maintain that balance of yin and yang, or quality and quantity. Thank you, Dr. Aditya. Dr. Praveen.
Yes, sir. Thank you very much. And the point I want to stress on 4 points. Any person who wants to
Okay.
write the paper should have 4 P's. One is persistence, second is perseverance, third is patience, and fourth is practice. And we should have these 4 pillars to build the culture of research. And publication is a matter of enjoyment. We should enjoy what we do, and once we, these are the things which will carry further. I may not be remaining for 100 years, but my publications will remain till the end. So keep that thing in mind, what we are going to leave for our future. It is our scientific contribution and our research. And when we do it, let us do it ethically, let us do it morally, let us do it precisely, and let us teach this to others also, how to move further. This is the point I wanted to stress. Thank you very much. I would like to thank all of you for giving me an opportunity to be with such a elite group of the speakers and researchers. Thank you very much.
Thank you, Dr. Praveen. So Dr. Praveen has given us 4 P's, the mantra, that is persistence, perseverance, patience, and I forgot the 4th P.
Practice.
What was that? Practice. Yes, so practice. And I always, since you brought up that, you always used to hear practice makes it perfect. But I had this one of the live session by Dr. Shiv Khera, who changed my views in 2004. He said, practice makes it perfect. Is it true? And many of them in the audience said yes. And then he said, no, practice makes it only permanent. If you keep practicing the wrong way, you'll think that you're doing it and it's perfect, but it's never perfect because you've done the wrong thing over and over again until it becomes a part of you. So practice makes it permanent. Please remember that. Sir Murli, sir, pearls of wisdom from you.
Yeah, so I think, Dr. Praveen has, his name starts with P, so he's also given us 4 P's. So I think the most important things that he mentioned, practice is very, very important. I know it makes it permanent only if you do not improve with each paper you write. So start simple, keep improving, strive always that your next project should be better than your previous one. And you must keep practicing it. One of Dr. Praveen's colleagues, Dr. Mahesh, the pulmonologist, one of the most prolific writers I know. And he told me once that, he walks down the corridors, he's thinking about what to write in the next half an hour before he leaves for the wards. He reaches his room after signing in and puts down at least a few sentences, then goes and does his rounds. When he's walking back, he's again thinking, what do I write in the next few sentences? That is a man who is totally persevering with his writing, who's totally committed to his writing. And that is what makes a good researcher and a brilliant writer. I have great admiration for him because I think he teaches us a lot about, how a clinician can be a true researcher and how a true researcher can bring out paper after paper after paper of high scientific quality. So all I'll say is you need to devote yourself to writing if you want to publish a lot. But even if you're a busy clinician, you can write. And, you just have to make sure that you have a commitment to writing and writing frequently. Start small and work your way up and make your practice improve with every single paper that you write.
Thank you, sir. I think very, very important tip, that start small, but keep growing. And that's very important. That's how, every journey starts with the first single step. So yes, very important. I think we've had a very fruitful discussion. I'm sure the audience would have learned a lot of things and they would have enjoyed this. We've tried to keep it very lively. We've tried to keep it very simple. And we've tried to give you the essence of converting your research into a manuscript. And I hope this has been a fruitful session. It's time to close. I know we are already beyond the time that we were supposed to close, but then we thought in the interest of the audience learning, we would continue, and we've finally decided to now close. So I would like to, on behalf of CCI, I would like to thank all the panelists. And of course, from all our end, we would also like to thank CCI and the office bearers, in particular, Dr. Krishna and Dr. Narayan Pradeepa, the trustees, as well as Dr. Vijay Kumar and all the others who have been involved. And at this juncture, I think I would also appreciate the Cipla team, especially who have been instrumental in bringing this webinar to you. Mr. Vinod, Mr. Puneet, Mr. Amit and their team. They have been instrumental in getting this across to you. Thank you so much. And of course, the audience, without you, this would have been meaningless, especially those who have interacted. Thank you so much. We wish you a very, very happy Diwali ahead and be happy, keep safe. Let's keep it for this next time when we meet again. Thank you so much.
Thanks to Dr. Animesh Jain. I think that was brilliant moderation. And Dr. Praveen, I've learned so much from you. Thank you so much.
Thank you.